Namaste. Welcome you all for the yoga session. In this session we are going to use a chair, a mat and a blanket. We are going to focus on Parsvottanasana using chair as a support. In between we are going to also have postures that would help us to get a better penetration into this standing posture. We shall begin with some simple postures for the core muscles, and later we shall end with a good soothing breathing technique. Lay on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back. That should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Now relax both the arms. Keep them by the side of the trunk, palm facing down. As we inhale, rise both arms up over the head. Then as we exhale, bring it back. Match the action of the breathing. Feel the weight of the arms as you move them up and down. Inhale up. At the end of the inhalation, it should have reached the ground again over the head. Then as you exhale, bring it back, taking the palm to the sides of the trunk. And at the end of the exhalation, the palm should land on the mat. Match your breathing and the action. This is good for the scapular region, the shoulder joint and the arms. A good way to also improve the depth of inhalation and exhalation. Also feel the position of the arms. Especially when you close the eyes, you must feel from within the position of the arms as they move up and down. That is, our ability of proprioception improves if we are able to move them as synchronously as possible. As you inhale, you must lift the arms and also ensure that as you inhale, the abdominal cavity expands. Then as you exhale, contract the abdominal muscles and also move the arms Watch the shoulder joints. Watch the scapular region. Watch the chest. Chin towards the chest. Feel your arms. Feel the weight of the arms as you move them up and down. Now relax the arms. You can fold the elbows, resting the palms on the abdomen and chest. Rise your right leg up, stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain, left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch at the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very, very attentively be done. Left leg down. Relax your breathing, watch your back, rise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule. And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time. Right leg up, fold, hold the knee, press the knee closer to the chest. From the hands you should pull it closer to the chest, but ensure that the hip, knee and ankle, they are all in the same plane. Release the right leg, chain, left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles a little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh from left hand, push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles, back of the thigh, so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible, then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chair. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Watch the complete paraspinal muscles. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. You have to pull powerfully and then push across the chest. Feel the stretch in the gluteal region, especially the gluteal maximus muscle gets a good stretch in this posture. Breathe well. Be aware of your breath. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. The gluteal maximus muscle is one of the major muscles of our body, so this posture gives a good and intense stretch for the gluteal maximus muscles. You have to push the knee across the chest so that you get a more penetrating stretch. Release left leg. One more time. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel the complete hip musculature. Feel the muscles of the lower back. To feel the muscles of the lower back or the posterior surface, you should use your breathing to sensitize that region. Release right leg, left leg. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. So this posture is also one of the very important postures for the health of the back. Release left leg. Just watch the posterior surface, the region of the lower back. Right leg fold, resting the heel on the left knee, then from left hand pull the left thigh and from right hand push the right knee. And you have to stretch the heel, both the heels, toes towards the knee. Feel the root of the or base of the right hip deep inside. You should get a good stretch. You must pull the left thigh. Now release the left thigh, then rest the right leg also on the chair. Fold your left leg, resting the left ankle right on the knee. From right hand, pull the right thigh, from left hand, push the left knee. You have to pull the thigh so that the heel is almost at the edge of the seat of the chair, and tighten the hamstrings. Breathe well. Feel the stretch deep inside the left hip. Release right leg. Rest the left leg also on the chair. One more time. Fold right leg, resting the heel on the left knee. From left hand, pull the left thigh. From right hand, push the knee. Breathe well. So this is a good stretch for the so-called piriformis muscle, which is located deep in the hip, and the sciatica nerve passes adjacent to this. Therefore, this stretch is also very useful. Release the legs, rest the legs on top of the chair, chain, fold left leg, left ankle on right knee from right hand, hold the right thigh, pull from left hand, push the left knee. Keep both heels active, toes towards the knee, and breathe well. Feel the complete region of the hip. Release right leg, then rest the left leg also on the seat of the chair. Rise both legs up, fold, hold the knee, press the knee closer to the chest. Stretch the heel, toes towards the knee. Knee as close to the chest as possible. Breathe well. Here the abdominal cavity. During inhalation, feels a better massaging effect because of the pressure of the thigh, and because of the same reason the thoracolumbar fascia, the thick skin at the back, that responds better to the breathing. Just watch that region as you inhale, exhale. Also here, tighten the back of the thigh, both legs, so that you can feel the knee capsule. The outer covering of the knee also gets enhanced stretch. Or release the legs, rest them on the chair, breathing relaxed. So this in some sense is a series of postures that would help the core muscles in a gentle way, and they prepare these core muscles for further action. Slowly get up from the right side. Sit on your heel and sit upright. Sit upright on your heel in Vajrasana. Keep a blanket below the knee. Chest and navel up. Watch your breathing. We are going to do the following. Hold the chair, take your right leg forward, right knee bent at 90 degrees, chest and navel up, and then gently flex the right knee as much as possible. Press the right foot. Hold the chair so that you get a good orientation for the trunk. The pelvis should not turn. So chair helps to get a good orientation. Watch the line and length of the left leg. Take care of the orientation of the left leg. It should not sway sideways. In this posture, the right hip is in flexion, left hip is in extension. This is a very good posture for the hip flexors. One of the important movements which would help the practice of other postures. Slowly come up, right leg back, chain, left leg forward, press the left foot, then gently flex the left knee as much as possible, chest and navel up, look forward. Watch your breathing. Watch the base of the spine. It's also good for the knee. Left knee is in flexion, right knee is nearly neutral, left foot is in dorsiflexion, right foot is in plantar flexion. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. The differential movement at the hip is very beneficial for the base of the spine. Slowly come up, take your left leg back, sit on your heel. Keep the complete spinal column well aligned. Sit upright on your knees. Keep a blanket below the knees. Sit on your heel. Sit upright. Watch your breathing. In all these standing postures, it is important to have good mobility at the lumbopelvic hip complex. Stand upright, stand closer to the chair, hold it out the chair, take your left leg apart, 4 to 4.5 feet apart, right foot oriented towards the chair, left foot also parallel to the right foot, bend the trunk a little forward, holding the top rib of the chair. Pull the kneecap, stretch the trunk, be strong on both the legs, press the left foot also firmly, push the root of the right thigh down, here the hips get into a differential movement. Be strong on both the legs. Keep on pulling the kneecap. Press the right foot evenly. Slowly bring the left leg forward. Chain. Right leg back. And bend slightly forward. Holding the top of the chair. Try to stretch the trunk. The bending of the trunk should come more from the hip, and very slightly there will be flexion of the trunk. Parsvottanasana. Be strong on both the legs. Watch both the hips, watch your pelvis. Slowly bring the right leg forward. Sit on your heel. So these standing postures help the complete leg muscles as well as the hip muscles. Standing postures provide a spectrum of movements for the complete leg and the trunk. So thus enabling the kinetic chain in our system to become better. Vajrasana helps the lower extremities. It's also good for the spinal muscles. Kneel down, right leg forward, bend, hold the chair, stretch the right foot to press against the lower rib of the chair. Keep the right knee flexed. Chest and navel up, press the heel down and pull the heel towards you and push the left knee. This action activates the back of the right thigh, the hamstring muscles. Ensure in the beginning to keep the knee slightly flexed. Then gently straighten the right leg. Extend the knee completely, pull the kneecap, straighten the quadriceps, chest and navel up. So this will ensure a good stretch for the Achilles tendon, the calf muscle as well as the hamstring muscles, the back of the thigh. For that you have to raise the chest and navel up. So this is where the chair helps you further. It gives a good support for you to push the right thigh down and lift the navel and trunk up. Slowly take right leg back, chain. Left leg forward, foot against the lower rib of the chair, left knee slightly bent to begin with. Press the left heel and pull towards the right knee so that the back of the thigh becomes active. Chest and navel up. Then gradually extend the left knee, pull the kneecap, stretch the heel, push the root of the left thigh down, lift the trunk and navel up. This is a very useful posture to tone the back of the thigh, the hamstring muscles. One of the very large muscles group that we have, and it has a very high degree of participation in many postures. Slowly take the left leg back, sit upright on your heel. Ideally, heel should be together and hips should sit on the heel. Watch your breathing. So the role of hamstrings, quadriceps, they are all important. Stand upright. Stand closer to the chair. Hold the top of the chair. Take your left leg back. Turn the left foot as much in as possible. And now rest the wrist on the top rib of the chair. Stretch the arms, stretch the trunk. Pull both the kneecaps. You can get a better stretch. You have to activate the muscles of the upper arm, forearm. You have to stretch the trunk. Pull both the kneecaps. Be strong on both the legs. Develop a feel for the breathing. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Be strong on both the legs. Press the outer edge of the left foot. You roll the right thigh in to place the foot properly. Left foot out to press the outer edge of the left foot. And stretch the trunk. Do not allow the trunk to buckle. Slowly come up. Take your left leg forward. Rest the wrist on top of the chair. Take your right leg back, 4.5 feet away. Stretch the arms. Stretch the trunk. Be strong on both the legs. Keep on pulling the kneecap. And watch your breathing. As you inhale, abdominal cavity should expand. As you exhale, it should contract. This posture is very good for the legs, hip and trunk. Especially the position of the trunk allows the abdominal organs to move away from the spinal column by virtue of gravity. Slowly come up, take your right leg forward, stand upright. Sit on your heel in Ujjayi. Watch your breathing. Stand up. Sit on the chair. Sit to your right side. Press the foot properly. Chest and navel up. Hold it over the chair. Inhale, exhale. Turn to your right side. Grip the chair and turn. Keep the shoulders even. Turn the neck also in the direction of the twist. With every inhalation, you should stretch the trunk. With every exhalation, you should twist the trunk. And then watch your breathing. As you inhale, the abdominal cavity should expand, and as you exhale, it should contract. Do not hold the breath. Twisting postures help relieving the stress in the lower back, also helps the intestinal organs. Slowly come up, change sides, sit to your left side. Sit upright. Hold the top of the chair, inhale, exhale, turn. Use the grip. Use your forearm and upper arm to induce a good stretch for the rotators of the trunk. The oblique muscles of the abdominal region also stand to benefit from twisting, and proper breathing ensures good massaging effect on the intestinal and pelvic muscles and organs. Slowly come up. Sit upright. Stand up. Sit on your heel. Stand upright. Stand closer to the chair. Now hold the seat of the chair from both hands. Left leg back, 4 to 4.5 feet apart. Check the orientation of the foot, both legs straight. Now gently bend forward, taking the forehead towards the chair. Be strong on both the legs. Stretch the trunk. Now you can see a slight flexion of the trunk, especially the lumbar region is involved. Relax the neck. If you cannot reach the seat of the chair, you may keep a couple of blankets or a pillow to adjust the height. Both legs straight. Slowly come up. Take your left leg forward. Right leg back. You have to maintain that line of movement. Then gently flex the arms, bend forward. In the sense, the heels should be as though they are one by the side of the other. So when you take the leg back, you should maintain that same line. Stretch the trunk as much as possible. Keep both legs straight. Be strong on both the legs. Watch your breathing. Push the root of the left thigh down and stretch the trunk so that you can create better freedom and space for breathing in the abdominal region. Slowly come up, take your right leg forward, stand upright. Sit on your heel. Watch your breathing. Pārśvottanasana also helps the pelvic cavity, the muscles and organs there. They get a nice rejuvenating movement in Parsvottanasana. Chest and navel up. Line your chest, keeping the chair in front. Rest the wrist on the edge of the seat. Press the palm on the seat of the chair. Both arms straight. Relax the neck. Stretch the toes back. Tighten the calf muscle. This is a good stretch for the shoulder joint and also the upper chest. Neck also stands to benefit. Be strong on both the arms. Tighten the muscles of the upper arm and forearm. Press the palm. Middle fingers pointing forward. Relax the neck. And if possible, rest the forehead on the mat. Flex both arms and relax. Press the palm. Slowly get up. This gives a very good stretch for the arms, the scapulae, as well as the upper chest. Sit upright in Vajrasana. Watch your breathing. Stand upright. Stand close to the chair. Bend and hold the seat of the chair. Take your left leg back 4 to 4.5 feet away. Note the orientation of the foot. Stretch the trunk, bend forward, rest the forehead on the seat of the chair and stretch both arms. Be strong on both the legs. Heels as though they are one by the side of the other. Parsvottanasana. Learn to stretch the trunk. Feel the breath. Push the root of the right thigh down. Roll the left thigh slightly out and press the outer edge of the left foot. Get involved. Get focused so that you should feel the complete trunk musculature. Do not allow the trunk to buckle too much. Flex the arms. Press the seat of the chair. Take your left leg forward. Change. Right leg back. 4.5 feet away. Note the orientation of the foot. Slowly bend forward. Rest the forehead on the seat of the chair. Stretch both arms. Push the root of the left thigh. And just watch your breathing. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Even pressure on the left ankle. Both legs straight, both arms straight. Flex the arms, slowly come up. Take right leg forward, stand upright. Sit on the chair. Sit upright. Chest and navel up. Foot little apart, foot parallel. Palms to face upward. Palms resting on the knee. Tip of the thumb and index finger in contact. Relax your tongue, nose, throat and the jaws. Keep the eyes gently closed. Have complete postural awareness. Now we are going to do the following. This is called the complete breath. As we inhale, the bottommost portion of the abdomen, then the middle, then the top, then the bottom of the chest, middle of the chest, top of the chest should expand in that order. Then simply relax, chest contracts, abdominal region also contracts, air comes out. Effortless exhalation. In this, we are using both the abdominal cavity and the chest cavity. As we inhale, the bottommost portion of the abdomen, middle, top, then the bottom of the chest, middle of the chest, top of the chest should expand. You should feel the movement of the ribs, expansion of the lungs, then simply relax, chest contracts, abdominal cavity also contracts, air comes out. With the same type of breathing, we are now going to do the Ujjayi Pranayama. In this, ensure that the chest is elevated. You should take the chin towards the chest, if possible, chin to the chest. Jalandhara Bandha, chin lock. Then contract the air tube and continue to inhale and exhale slowly and steadily. The complete breath has to be maintained. In Ujjayi, as we inhale and exhale, there will be a accompanying soothing sound by virtue of the contraction of the air tube. Listen to that. Chest up. As we exhale, chin to the chest. Slightly contract. Then slowly inhale. Complete inhalation, complete exhalation. As we inhale, the abdomen, that is the bottom of the abdomen, middle, top, then bottom of the chest, middle of the chest, top of the chest should expand. In Ujjayi, there will be an accompanying sound as we inhale. Then similarly, you exhale, there will be an accompanying sound of exhalation also. Listen to that soothing sound, feel that sound, feel your breathing. That is a soothing, mild sound, not harsh or disturbing in nature. Feel that. When you take the chin towards the chest, ensure that the chest does not collapse. You should hold the chest upright. Watch your breathing. Feel the sound of the breath. The sound of the inhalation and exhalation, they will be different. Be sensitive to recognize the difference. This kind of breathing is very, very useful. It recruits both the abdomen and chest cavities. Pelvic cavity is also included. The diaphragm moves to the full range. And you can reach every nook and corner of the lungs. because of the chin lock, the thyroid and parathyroid glands, they get a good stimulation, and they in turn help the overall health of the body. And this Ujjayi Pranayama is also known to elevate our moods, in the sense it instills a sense of better feel. Be watchful, be aware. You must breathe mindfully. Listen to the sound completely, totally. Get completely absorbed with the flow of the breath, with the movements in the pelvis, abdomen, chest, the movements of the diaphragm. Diaphragm is the major muscle of breathing which divides the chest and the abdomen. Just be aware. Be aware of the chin lock. Be aware of the sound associated with inhalation, exhalation. When you do all this, ensure that the tongue is relaxed. Pay attention to the flow of the breath through the nostrils. And what happens at the junction of the throat because of the compression. The air flow down from the beginning of the air tube becomes slightly turbulent because of the compression. Feel that. You should use these breathing techniques to educate the mind to stay in the present, to come out of that compulsive thinking. For that, you should develop deeper awareness about the breath. So when the mind can completely be focused on the breath, it learns to break the habit of compulsive thinking. After you exhale, slowly lift the neck up and relax. Just watch your breathing. Come back to normal inhalation, normal exhalation. But be aware. Just watch. Go deep into your own self. Feel the calmness and feel that feel good factor. Namaste.